Welcome to the Mentors and Moguls podcast, your source for the inside scoop from some of the world's most accomplished business leaders, athletes, and creatives on how they've achieved success. I'm Heather Stone, a serial entrepreneur with a passion for helping others to overcome challenges and discover their untapped potential. Join me and our guests as we teach you how to break through those barriers on the way to crushing your goals. In each episode, I dive into a new topic with an inspiring mentor to find out exactly how they overcame obstacles, slayed self-doubt, and achieved their goals. Today's expert mentoring session is about to start, so grab your pen and let's dive in. In light of the current pandemic, I felt it was very important to bring our next guest on to discuss some very important topics. Dr. Danielle Delaney is a Th.D. She is a certified crisis intervention counselor, a specialist in addiction and recovery aftercare, a rape crisis counselor, a spiritual counselor, and a sober coach and an interventionist. I am so pleased that she is here today to share some of her wisdom and share some tools with you all as we navigate this uncertain time. Hello, Dr. Delaney. I am so fortunate to have your voice speaking to us on our show during this uncertain time. So many people are struggling with addiction and mental health, and I thought that you would be a perfect person to help guide them from the darkness back into the light of the future that we know is just around the corner. So welcome.
Thank you for having me. I'm happy to be here.
I have so many questions, so let's just jump right to it. How is the mental health care field impacted by this crisis?
Collectively, we're all doing our best, and some of us are more adversely affected than others because some practitioners and clinicians are suffering burnout, others are thriving. I mean, it's a really good question because I'm in private practice, so it's pretty much close to business as usual for me, and then some because there's a lot of additional clients or clients circling back that I haven't heard from in a year or more that are reaching out. And I'm doing everything remotely and I have a very full schedule, but there are other clinicians who may work at a facility, at a rehab facility or some sort of mental health facility. And they have the stress of job loss possibility or of the facility closing, depending on how business goes, or they have to decide if their own health can allow them to physically go to work. Because, if you work at a rehab facility, you're showing up for work 5 days a week or 4 days a week. So as far as the entire field, I would say that many healers are hurting. A lot of healers are hurting emotionally, and it's a lot to take in, a lot to take on, and having this many clients in distress, it's just difficult. It's very difficult, but many in the mental health and recovery field are also in some form of recovery themselves that led them to their work. So this is a trying time for them, and it's a dangerous time for people in recovery. So they have to be very, very vigilant about their own self-care.
And social distancing, I can't imagine having another layer of hardship put on top of people that are struggling already. So how is the social distancing really affecting physically people that are trying to help others through the recovery, through the counseling? Is that making a major impact?
It does. I mean, a lot of clinicians, I already did a lot of phone sessions. I meet clients in California that often leave facilities and live in other countries or other states. So I was always someone who did an equal amount of in-person and online or telephone sessions or even Skype. So I already had that going on, but a lot of people are new to it. So they're kind of floundering and trying to learn how to do these Zoom meetings and do phone sessions. And it is different because it doesn't have that high touch sensitivity level as having someone sitting in front of me. But a lot of my clients were already used to it because they live everywhere from Tel Aviv to Dublin to Luxembourg. So I have them worldwide, but other people seem to be getting used to it. And as far as group therapy and even AA meetings or Al-Anon meetings, a lot of those things can be found online now. And then some places like the rehabs, I know some of them are doing group therapy with people in person that are in treatment there, and they have every other seat and people are wearing masks. So it's similar to what's going on in regular life, what's going on inside facilities, and they're testing people. So everyone's doing the best they can, but as you know, it's new territory for everybody.
Right. What particular features or experiences that people have had lend themselves to coping well with such an unforeseen crisis?
That's also an excellent question because there are people who are coping well and there are people who are on the edge every day. And it's a certain type of personality, which I think some people have more emotional muscle developed already from major trauma of our own. So if you have something in your history you've had to overcome, whether it's an assault, like I've written about it in my book, and I'll expand on that a little bit in a minute, but some people have a major divorce or a major loss, or have lost jobs before and had to rebuild their life, or had something else major happen, survived an earthquake, a natural disaster, Hurricane Katrina, something like that. So some people, it actually helps to have survived something that seemed insurmountable at the time in our own personal history. And the trauma I've suffered, I'm a kidnap and rape survivor. I wrote about it in my book, which is called Expect Delays: How to Reclaim Your Life, Light, and Soul After Trauma. And that's at expectdelaysbook.com if you're interested. And it tells the entire experience and how I healed. But I have a resilience that some people don't have, and that I have a resilience that I didn't have before that happened to me. And that was 15 years ago. But that resilience, post-traumatic growth you can experience as well as post-traumatic stress. You can experience growth. And that's really serving me now. And it helps very much for people to stay present and focus on the here and now in each moment. But if you have that resilience from something else that you've gone through and can reflect upon that, it can be very helpful.
Kind of like an old muscle, you just have to start flexing again, and hopefully it serves you.
Exactly. Use it or lose it. And in life, we tend to use it because things come at us fast and furious. And right now, nobody, most people at least, did not expect this. And everyone's kind of learning as we go. There's quite the learning curve. But if you have that already in your history, it's actually beneficial right now.
Mm-hmm. What do you recommend to your patients in order to get through this particular time of crisis?
Well, there's a lot. It varies per person, but if at all possible, I highly recommend to my clients that have already been in treatment, so they're already sort of experienced in my method of working with them, and I know what their life history is and their story. I recommend structure and doing what feels quote unquote normal wherever it's possible. For example, shower, make the bed. When you wake up, just shower and make the bed. And that gives you a sense of order and a sense of normalcy. And then if you can, some form of movement, it can be very gentle. If you have like a cycling machine in your house, or if you can go walking, if you're in a safe area to do that with social distancing, I think that can help. I know it can, because the endorphins of just some physical movement, no matter how gentle, it's helpful. And then I also recommend, if you were having meals at certain times, if you had coffee and fruit when you woke up, and then had a little protein, and then later have lunch. If that's what your normal life was, breakfast, lunch, dinner, some snacks in between, some healthy snacks, try to stick with the healthy food choices you had before this crisis. It doesn't mean that we need to eat garbage because we're in crisis, and that's what often happens. And if you take vitamins and supplements, continue to. If you don't, they're a great thing to add in right now. And of course, talk to your doctor, find out what's contraindicated with your medications if you take any, because some supplements can block absorption of your medications. So you want to be careful with that. But vitamins are a great addition right now. Sleep, if you can. Some people have insomnia through this stress, and that's natural and normal. And so people's sleep schedules are all over the place now. And if you can, keeping that as normal as possible, same time to sleep, same time to wake up. That's always good advice anytime, but in crisis, if you can do that, then that's great. And perfection is just not to be expected in any area right now. So be easy on yourself. I think even progress isn't to be really expected right now. Be kind to yourself. You don't have to come out of a pandemic with abs, and you don't have to come out of it speaking a few extra languages that you didn't speak before. You can, but it's an awful lot to expect and a lot to ask. So in a nutshell, I would say, and I will say, structure is what I recommend when you can have it. And even when you don't have that, read, rest, and relax, and remember to breathe. And I think one of the largest things I recommend is talking and staying connected. So even if you're not in therapy, stay in touch with people that you are thinking about, that may be thinking about you or not, but everybody's feeling a disconnect, and everyone's in a state of fear. So just being in touch, just touching base with some people every day. If you can touch base with a few human beings, that helps. Whether you live with them, or whether you're calling people, or whether you're online, touching base helps a lot. And therapy, if you can, if you can handle it, if you can pay for it, if you can find a hotline, and I'll throw out some numbers at the end of our conversation. but having some support really helps. And a lot of counselors and therapists and clinicians have sliding scale rates right now because we know people need it more than ever. So I recommend all of those things. And absolutely, if you can keep some structure, very helpful.
That's helpful advice. So what strategies do you not recommend trying for coping with this time right now?
Well, that's one of those things, like I mentioned in my last answer to you, try not to overindulge in any way. The junk food, we're all kind of veering toward comfort food right now, which is okay. And for some people, that's pasta and rice and things that we didn't have as much of as a staple in our diet. And it's okay, if we gain a little bit here and there, and during this time period, we can take it off later. This is not a time to look for perfection. So what I don't recommend is overindulging extremely, because then the guilt emotions come in and you don't feel well, and that's not helpful. And I wouldn't overindulge in anything such as food or drugs or alcohol, because some of these old habits can come back up, or it just starts to sound like a great idea. Some people have the doom and gloom mentality. It's the end of the world. So why not try everything? And that's never helpful to get involved with unhealthy things that can become a habit. And I also recommend not getting overly involved in the news cycle, right? I mean, you don't have to watch the 3 o'clock news, the 5 o'clock news, and the 11 o'clock news. When you start seeing that it's repetitive, that's unhealthy for you. And the same with exercise. Don't overindulge in exercise. Like I said, in our prior life, certain things you have to limit because you don't want to pull a muscle. You don't want to hurt yourself during this time. And just like in your normal, quote unquote, normal prior life, avoiding negative and toxic people, that always needs to be avoided as much as possible, because exposure to really negative, toxic people takes a toll on us. And if you can avoid it, if you don't live with them, then you want to avoid that at all costs right now, because we're all trying to stay on the sunny side of the street mentally, emotionally.
Okay, so I just have to say, avoiding toxic and negative people, many of us don't have a problem with that, but I happen to know some people that live and they are in isolation with negative and toxic people. So what advice would you give them? They can't get away. They're in a 3-bedroom apartment. Any thoughts about not engaging, or you're the pro? What would you suggest?
Well, there's only so much you can do in a situation like that. And once again, if you can reach out and have some counseling regularly, find some sliding scale rate. I'm listed in Psychology Today. Many, many people are listed in Psychology Today that may be helpful in your area. And you can do phone sessions if you can find any privacy in that smaller apartment to make some calls so that you're venting to someone else. It can take some of the sting out of that negative and toxic environment and the conversations you may be having with that person. And remember, take everything with a grain of salt that person is saying and directing at you. I mean, of course, there's some extreme situations of abuse and very difficult situations, and that's another story altogether. But if you're living with someone who just has a difficult personality, negative, toxic behaviors. Some people were in the middle of a divorce and they were about to move out and then this hit. Or they were living with someone and they were about to break up and then this happened. And it's not a great time to be organizing a move and looking for an apartment. So there's plenty of situations like that. And unfortunately, they have to kind of ride it out and try as hard as they can to look for counseling outlets such as counseling and therapy and hotlines, but also really recognizing that we're all in a very tough situation and trying not to allow it to get in as much as it usually would, because a negative person is going to be extra negative right now. And just, who you're dealing with. And keep in mind, who you're dealing with, and separate where you can, where you can. If it's a 3-bedroom apartment, be in a different room when they're in the living room. Do what you can to emotionally and physically distance, and just deep breathing. It's very hard to tolerate that kind of a personality, but it can be done. It can be done. And this isn't forever. Keeping in mind, this is today. Things are changing rapidly, and this isn't going to last forever.
That's right. So what do you think will be different after the crisis passes as far as mental health, individually and collectively? What will be different?
Well, the effects are tangible, and they're also emotional and mental. I mean, we have the financial catastrophes that may be coming, and then as well, we have emotional and mental, emotional difficulties that we're trying to overcome right now, but certain things from the past are creeping back in as well. But I do think and hope that individually we'll all be a little bit more self-aware. because we've been forced to really recognize who is important to us, what is important to us right now, which things we can and can't live without, and which things we really are missing during this time that businesses are closed and things that we used to do, we can't do them right now. So I think recognizing what's important to us is going to be a huge thing in our future. And then also facing our behaviors and our patterns is something we've gone through during this, and that we've survived this. When we come out of this, we'll be able to be more introspective, but also recognize that we came through this stronger if we're still here, those of us that are surviving this. So hopefully we'll also be slowing down some, and some people may feel less pressure and some may feel more. But I think collectively we'll be more aware of our resources, and shows like yours that are helping people here today with, letting them know some resources that they can reach out to. And we'll also know that we can reach the brink of insanity together in this world, and that we came together to survive it. So we will have been through trauma, we will have been through crisis, and there'll be some trauma bonding. And I feel that the effects of this will cause some PTSD without a doubt. And coping with death will be our most immediate need. And then the economic adversity and lingering psychological issues are really beginning to take shape right now, and they'll need to be addressed in the aftermath of this.
Many people have found themselves dealing with the trauma of losing a loved one as a result of COVID-19. Maybe they weren't able to be with them through the final days of their lives due to social distancing guidelines. I'm sure that they will need to have some sort of counseling when this is all over and the reality sets in. What can they do to work through these unresolved feelings of loss, maybe even misguided guilt for that matter?
Oh, that's such a tough one. And it's so individual. And each of these situations is so heartbreaking.
Right.
Grief counseling is a very specific area. And I'm not particularly a grief counselor. So I usually refer out and send people to another grief counselor. I just think it doesn't do anyone any favors to pretend to be an expert in areas that we're not. So I always think if that's out of my range, out of my scope, I send someone to another counselor and I find them a specific grief counselor in their area. But I feel that it's going to be very necessary for many, and all kinds of therapy are going to be necessary. But if I have someone who's grieving, there are some books I recommend, and just feelings of loss and survivor's guilt are unavoidable in those sorts of circumstances. So as far as tools to cope, I think the first thing you can do is just honor those feelings and hold space for them, because grief counseling, it's just another animal altogether. It's very different from regular day-to-day counseling. And it's an experience that changed you. You lost a loved one. The feelings are valid. So you want to honor them. I think journaling is a great tool. And in lieu of counseling, writing down how you feel and to do something to commemorate or memorialize that person, something ceremonial or otherwise, something with lighting candles. Or I remember losing someone once when I lived in a little Melrose Place type courtyard, and she was an older woman. It was heartbreaking. And what we did is we put pictures of her on balloons and released them, which I don't know how environmentally sound that is. But at the time, this was about 20 years ago, it made everyone feel a sense of peace that we'd released her from the courtyard and from her existence here. So it wasn't a lot of balloons, but it was just something to sort of ease that feeling that she was trapped where she lost her life. And it's a tough one, and you definitely don't want to ignore it. And insomnia is very normal when you're grieving. That much I do know as a counselor. And I do know that with counseling and with time that you can heal.
Mm-hmm. Okay. So definitely talk to somebody. Don't keep it all bottled up inside. Reach out, talk to somebody. There's people to talk to.
Exactly. I think it's very important. I think journaling is important as far as, if you're waking up in the middle of the night and you're thinking about this person, you're feeling so much grief and so much stress and so much guilt, possibly. Write it out. Write it out. And you can write a letter to that person. You can write journal entries that you can look at later and recognize where you've progressed. And it's a good start as well while you're looking for a counselor, so that you can describe to them the feelings you're having and what your thoughts are, so that they can know and have an inside track on what's going on with you. So all of those things will be helpful, but it's a tough thing. I mean, death is never easy, and coping with that is individual for each person. And I do have some books I recommend. So if you want to, you can always send me an email, Google me, send an email, and I'm happy to recommend a couple of books that might be helpful.
Terrific. So what if you've got a friend or a family member and you're noticing and you're witnessing some evidence that they've got some heightened behavior due to this crisis? Maybe they're falling back into that old prescription drug habit, or they're doing a little bit too much self-medicating because they're sitting around too much. Can you give them some things to look for as far as tool goes, something to help them, maybe to help that other person? What do you recommend in that situation?
Well, what you're looking for in a situation like that, and many of us will have those situations with loved ones, you're keeping an eye out for erratic behavior, drastic mood swings, intoxication, which can be obvious. You can notice that someone's stumbling around or seems cloudy and unclear and just clearly intoxicated and on something. Sleeping an extreme amount or not sleeping at all, both of those are signs of something's going on there, especially if it's someone who has a history of drug or alcohol use. And then paraphernalia. If you're noticing things that look like drug paraphernalia and you think that's unusual, you're probably right. I say do speak up, and you want to do that gently, not in an accusing way, but opening up a discussion. And using I language is always important when you're confronting someone about anything that's difficult, meaning I feel or I am noticing or I want to help you instead of you're doing this, you don't want to do that. And you want to show concern. You want to show concern rather than judgment is important. And you want to ask how you can help and understand that there's a sadness going on and there's also this constant sameness that is driving people to just to the brink. They want to do something that differentiates the days. So some people are using more than they normally would, even if it's alcohol, and even if they're not an alcoholic, they may be overindulging. So just asking how you can help and letting them know you're noticing this and that you want to show concern. And like I said, concern, not judgment.
Okay, that's really good advice, because obviously some people will react in the denial phase and you're just trying to help. So you might push a button that you didn't mean to push. It's a tough field to navigate.
Definitely. So be careful. But what you don't want to do is seem really judgmental.
So when you're counseling someone that's really trying to help themselves getting out of a situation and getting out of bad habits, do you have any core values that you try and tap into to bring people back around, maybe to help them fight? Do you tap into their self-confidence or a sense of hope? What triggers that person to say, okay, I can do this and I want to get better?
Well, some people have absolutely no self-confidence when they're going through a traumatic event, and this is traumatic collectively for everyone. So right now, confidence is at an all-time low. So I would lean more into the hope, helping people, fight adversity by giving them some hope. And it's difficult. Gentleness is really key. And being gentle, you also want to be specific to this person. And this individual is suffering, so you want to be specific with them about what they're going through. And really, each person is different. Some people have a faith. Most of us have faith in something. Even an atheist believes in something. And a higher power varies to so many people. That's what people often have trouble with in these recovery meetings. And they say, God as you understand it. And I always explain to people that doesn't have to be God as organized religion structures it. It's a higher power can vary. Just look at a tree, look at a hummingbird and a beautiful animal like the tigers. We've all been watching that tiger thing. So just looking at a beautiful animal, you recognize that a tiger or a flower, we didn't make that. There's something larger than us in this world. So if you lean into that and you offer this person some hope and just the possibility and a sense of tomorrow. Like I said earlier, today is only today. It may feel longer than 24 hours, but it's only today. There is always tomorrow. There's always hope. And my book that I wrote, it talks about how I am living proof of that. I went through hell and came through the other side. And I like to state that I'm living proof because it's absolutely the truth. You can survive anything. Getting through this time is difficult, but not impossible.
What was the one thing? Was there one aha moment? I know it was a steady climb for you, but was there one thing that really you clung to recover every day when the struggle was just overwhelming?
It was a series of things, but it was overwhelming. That's the perfect word, because I was healing and living with family after my assaults. There were more than one assault, 2 in a row with 19 months only in between. And I was going through so much, and it was very difficult to find a counselor. So that's another thing I like to tell people always. If you can't find the right counselor, keep trying, keep going, because I went through 12 and I have no problem admitting it because they just weren't the appropriate one for me. And some were too expensive. Some had a mentality that I didn't like or a manner that I didn't like. Keep reaching for therapy and counseling and support. If you don't like one, move on. Nothing wrong with it. We understand that. Everybody's not a fit. So that's fine. for me personally, my thing that got me through, fortunately, I had my mother. She basically saved my life. And she did save my life by staying with her and having such a hopeful and loving support system with her. And the rest of my family was great too. But my mom was who I was living with. I had to move with her in order to take time to heal. I couldn't work. I was going through a lot. But I remember specifically a moment where I realized I was swimming upstream. I was swimming against the current. I hated where I was. I love her, but I didn't want to be living at home at the time. And I was just angry. I felt like the things in my life that were positive had been taken away. And walking on the beach one day, fortunately, she lives by the beach. I remember just sitting at one of the lifeguard stations, breathing in and breathing out and realizing I'm here now. Stop fighting where you are. This is where you are. This is where we're collectively right now. And all we can do is sort of go with it. And as soon as I stopped fighting against my circumstances and thought, okay, let's go with this. Let's stop swimming upstream. What do I like about this area? What do I like about this moment? What can I find in this? That's when I started to realize I needed to go back to school. I needed to do something different. And I didn't need to be in such a hurry to move out of the circumstances I found myself in. I needed to experience it and see what I could learn from it. And it was a life-changing moment. It's sort of a small adjustment in mentality, but it changed everything. So that helps a lot to have hope. And of course, it helps to be surrounded by people that are hopeful and positive. And that's exactly what my mother was. She's a beautiful person. But keep looking for it. Keep looking for it. If it's not in your home environment or your friends and family, look for support, look for counseling. And you might have that light bulb moment yourself where you realize, I can get through this. There is hope. And I think that's the ultimate goal, is to realize that there's hope. No matter what, there's always hope.
Yeah, well, you are a beautiful example of someone who took some devastating, unforeseen trauma in your life and turned it around, and you are just a force out there for good, helping others. So I applaud you for that. I think that hope is a big word for a lot of people. A lot of people think it's never going to end. It's never going to get better. This is my circumstance. They can't see it. It might be right around the corner, but they can't see it. What would you say to someone that says, I just can't go on anymore? This is too difficult. It's beyond me. I've tried everything. How would you talk to someone if you're sitting on the curbside with them?
Well, there's an old Martin Luther King quote about, even if you can only see directly in front of your headlights, that's enough. You can still see. And I don't know the exact quote right now, but that's basically the philosophy. It's the hope is there, your life is there, your future is there. Even if you can only see the tiniest step in front of you, take that step. Every day, there's just that little bit. You woke up today. So take that next step, whether it's just brushing your teeth, showering. I'm telling you, with depression, you don't want to get out of bed. You can't see the light. It's so daunting and so overwhelming and all-encompassing. And I'm sure some of you know exactly what I'm talking about. But just having that little bit of, just push yourself the tiniest bit, not a lot. You don't need to overwhelm yourself, but that's there, just that one little step. And even if you can only see so little ahead of you through the fog, it's there. So just keep going. Just keep going. When you're going through hell, keep going. That's an expression for a reason. Don't stop where you are. Keep moving forward.
There is an end in sight, and it's a good end if you can just hang on.
Exactly. And I'd like to throw out right now, if I can, I'd like to throw out the National Suicide Prevention Lifeline. It's 1-800-273-8255. And that's really helpful. And anybody struggling with mental health, please just know you're not alone. We all experience negative emotions in our life, and they really serve as an important function to help us move more toward the positive. It's a learning curve, and keep going, keep reaching for help. We're all doing the best we can here. We're all in this together.
We are all in this together. I think there's absolutely no shame in reaching out for help. We need one another to get us through this time. And so I'm happy that people are looking for alternatives and people to speak to like you to help them through this dark time.
I agree. I think, reaching for help is always a brave act, never anything to be ashamed of. And I had to really wrap my brain around that when I went through 12 therapists, I promise you. But it's definitely finding the right fit for yourself and reading too. You don't have to be calling hotlines, and you can look online, read books, learn what you can do to help yourself as well. And some of my resources you can find at DanielleDelaneyCounseling.com. That's Danielle, Danielle, Delaney, Delaney, and counseling, COUNSELING.com. And all of my social media is on there as well. So it's helpful to reach out, see what you can do. There's also a contact page on my website. So if you need to reach me, it's on there. Or you can inbox me on Instagram at It's Dani Delaney. That's DANI Delaney. I'm kind of all over the place as far as being reachable. So I'm a very busy person, but I'm also accessible, and I pride myself on being able to be accessible. So if you're really needing help, please reach out. If not to me, then to someone else. And like I said, there's a lot of clinicians listed in Psychology Today, and a lot of people are doing phone sessions right now, and a lot of people are doing the sliding scale. So help isn't out of your reach. It isn't. So look for it.
Well, I appreciate all of the comments and the feedback and all the knowledge that you've shared with me and shared with our audience today. And I'm very grateful that you had the time to speak with us. And I know you've helped many people through this conversation. So thank you, Dr. Delaney.
Oh, thank you. Thanks for having me.
That's all for this week. Thank you for listening to the Mentors and Moguls podcast. If you enjoyed this episode, please take a minute to rate and review the Mentors and Moguls podcast wherever you listen to podcasts. You can find bonus video episodes at mentorsandmogulspodcast.com or check out our events page and our blog at heatherrstone.com. Until next time, make it a great day.